All right, so my disease that I chose to do is Moyamoya disease. So, what is the Moyamoya disease? The Moyamoya disease is a rare progressive cerebral vascular disorder caused by blocked arteries at the base of the brain in the area called the basal ganglia. So, this was first discovered in Japan, and the name Moyamoya in Japanese means puff of smoke to describe the appearance of the tiny vessels compensating for the blockage. So as you can see here, this is an image, and they kind of look like cigarette smokes right here. So what is the pathology of Moyamoya? The cause of Moyamoya is currently unknown, but is believed to be genetic. It can be characterized by progressive stenosis of the arteries of the circle of Willis, and initially involves the intracranial carotid artery, arteries bilaterally, and can progress to involve both the middle cerebral artery and and the posterior cerebral arteries as well. This causes abnormal capillary network at the base of the brain, or a hazy puff of smoke, as we saw in the last PowerPoint. This can result into TIAs, which are mini strokes or actual strokes. So, what are some statistics in populations that are affected most? So, the Moyamoya, the average diagnosis is about 7 years old, but it can range from 5 to 10 years, and then it can go up to 30 to 50 years. And as stated before, the Moyamoya is said to be caused through genetics. So, with the specifics of the genetics, it's been recently found that the ring finger 213 or RNF213 gene has been identified as a possible suspect for Moyamoya in the East Asian population. The variant of RNF213 was identified in 95% of patients with familial Moyamoya, so that means people who have a family history that they have Moyamoya, and 80% with sporadic Moyamoya, so that means people who don't have any family or previous history of having any Moyamoya in their family. Some more statistics in population affected. The population that is susceptible to Moyamoya disease is estimated to be about 16.16 million people in East Asian countries. The number of patients with Moyamoya disease is considered to be 53,800 of the East Asian population. So the new generic variants in RNF213 have been recently found in the United States. Since the similar gene found in East Asia does not affect Westerners or Southern Asians individually, or Asian individuals. Moyamoya disease can be associated with many genetically transmitted disorders, including neurofibromatosis, Down syndrome, sickle cell anemia, uh, collagen vascular disease. So some physical therapy interventions, depending on the severity of the stroke that's secondary to Moyamoya. Physical therapy intervention involves in working and improving weakness, specifically sometimes in the bilateral lower extremities, or increasing mobility, improving balance, and helping improve functional mobility. Once the patient has improved from an acute care setting, the patient can be moved to inpatient therapy for more intense therapy. So exercise that can benefit the patients include sit to stands, quad sets, side stepping, marching in place, and heel slides. These are the kind of things that can help patients in an acute care setting help improve with the weakness that they're having and balance issues, and also help improve those functional abilities, as I stated before. So medical interventions. So there's two kinds of medical interventions that uh, surgeons can do. So the first one is direct revascularization, or STA, which is STA to MCA bypass. So which this basically means it involves actually joining the superficial temporal artery to a blood vessel on the surface of the brain. So I can see at this top picture right here, they make a cut in the superficial temporal artery, and then they just kind of stitch it together, and it creates a little bypass. And then the second one, indirect revascularization, basically means involves dissecting out blood vessels on the scalp and then laying them directly on the brain to encourage the growth of the new vessels. So basically, what they do is they open the head, and there's a vessel right there. So what they do, instead of it going straight like that, they kind of move all this and then kind of sew it here, sew it here, sew it here, and then it goes back to where it originally was. And so from there, it, like it says, it grows kind of tiny vessels and help provide circulation to the parts of the brain that were damaged because of the stroke or are not receiving enough blood because of Moyamoya, which causes those blockage. So the reason why I chose this topic, so I chose this topic because of my experience in UAB, where I was able to treat a patient who had Moyamoya. So me and my CI, we had this one patient. She was 19 years old. She had Moyamoya. She had a stroke, and so I actually worked with her personally, and just like how um, I was stating before, she was fatigued. She was having just weakness. Mainly it was endurance. She wasn't as bad. Um, and I mean, she's just like a regular stroke patient, like any other stroke patient, dealing with the same issues. And so working with her and learning about her experience and learning about um, the disease itself, which was something I've never heard about, was why I wanted to do this topic and kind of go a little bit more in depth to see what actually was the cause, especially the genetic stuff, which I didn't really know. So that was why I chose it. And here are my resources. And thank you so much for watching.